So our next topic is roseola. So far we have discussed some rashes. For example, the rash of roviola and rubella. This starts on the head and neck and then spreads to the body. While the rash in scarlet fever, it starts on the trunk and then spreads to the limbs, and it spares the palms and sole. While the rash in Kawasaki disease also has a similar uh, mode of spread, but it involves the palms and soles as well. Now, roseola. In roseola, there is a high grade fever that is followed by non-itchy rash on chest or legs. So there are only two symptoms: high grade fever followed by a non-itchy rash on chest or legs, and then spreads to the body. Then your diagnosis will be roseola. And the next one is erythema infectiosum, or fifth disease, or parvovirus B19. Remember that it is also known as slab cheek syndrome because in the children who suffer from this erythema infectiosum or parvovirus B19, uh, there is a slab cheek appearance, bright red rash on the both cheeks is present that spares the nasolabial fold and then spreads to the body. Roseola is the commonest rash of its kind under 2 years old, commonly seen even under 3 years of age, fever that is lasting up to 3 to 5 days, and rash start after the fever subsides. In most cases, child is usually well. So you can see that the rash appears 3 to 5 days after the fever. While in Kawasaki disease, we saw that uh, the fever duration is also almost 5 days. But in Kawasaki disease, there were other features as well. While in case of roseola, the child is usually well and he is not toxic and there are no other signs and symptoms. So a simple mnemonic to remember roseola, that roseola is common below 3 years of age, fever lasts for 3 days, and rash appear after the fever, and it is caused by human herpes virus 6. Now another disease is hand, foot, and mouth disease. It is caused by Coxsackie virus, painful ulcers on the tongue, gray blisters on hands and feet. So this is why this is called as hand, foot, and mouth disease, because it affects these three areas: painful ulcers on the tongue, gray blisters on hand and feet. Our diagnosis will be hand, foot, and mouth disease, and it is caused by Coxsackie virus. Remember that the treatment in most of the viral infection is supportive plus reassurance. But if we are suspecting meningitis, that is rash, neck stiffness, photophobia, uncontrollable fever, then the management will be different. Now the next viral infection is chickenpox or Bacillus zoster virus. Varicella zoster or chickenpox is a very contagious virus. It mainly spread by respiratory airborne route, but it can also be spread by a direct contact. Once the vesicles of chickenpox are dried and crusted, no transmission can occur. The infectivity period of chickenpox is 2 days before the appearance of the rash and 5 days after the appearance of the rash. In Plab case, it is written that 4 days before the appearance of the rash. But in Plabable, it is written that the infectivity period is 2 days before the appearance of the rash and 5 days after the appearance of the rash. And that's the correct range of this infectivity period. That 2 days before and 5 days after the appearance of the rash. The patient will present with fever and pruritic itchy rash, macules, papules, or vesicles. So a pruritic itchy vesicular rash. This rash is different from all other rashes because in this rash or in chickenpox, there is formation of fluid filled vesicles. Initially macules, then papules, and then fluid filled vesicles, which then rupture and then become dry and crusted. They also start on the face and spreading mainly to the chest and back. Now, when can a child with chickenpox return to school? A child can return to school 5 days after the appearance of the rash, or after the rash, the vesicles are dried and crusted. So, if the vesicles are dried and crusted, or if there is more than 5 days has occurred to the onset of rash, then the child can return to the school. The treatment is mainly supportive because it's a viral infection. So plus supportive measures. Now, if there are superimposed bacterial infection, then how we are going to know that it is bacterial infection? If there is discharging pustules, redness around the vesicles, and pinkish fluid is secreted from the lesion with high fever, then we'll think of giving oral antibiotics. Now, you need to remember 3 scenarios in which you need to give varicella zoster immunoglobulins, and 3 scenarios in which you need to give acyclovir. In immunocompromised patients, in pregnant patients, and in newborns, varicella zoster virus can cause serious disease, serious complication. That's why in these 3 circumstances, you need to either give varicella zoster immunoglobulins or oral acyclovir. Now, if a person is exposed to varicella zoster virus and he is either immunocompromised, he is pregnant, or he is newborn, remember that the peripartum exposure period is 7 days before and 7 days after the delivery. For adults, the period is 2 days before and 5 days after the appearance of the rash. But for neonates, it's 7 days before and 7 days after the delivery. So if an immunocompromised patient, such as patient with HIV or patient undergoing chemotherapy, or a pregnant female or a newborn, if they are exposed to varicella zoster virus, then first of all, we'll need to check IVIG, IV immunoglobulins against varicella zoster. And if there are no immunoglobulins, it means they are not immune, then we need to give varicella zoster immunoglobulins. And if any of these 3 develop varicella zoster infection, then there is no use of giving these immunoglobulins. Then we'll use oral acyclovir. So the treatment is required only if the patient is immunocompromised or pregnant or a newborn who develops chickenpox. If he is exposed to chickenpox, then immunoglobulins, and if they develop chickenpox, then oral acyclovir. Now a short summary of all the rashes. A sudden high-grade fever in a child followed by a rash on chest, body, and legs. So only fever and rash, and the rash started on chest. No other symptoms. Your diagnosis will be roseola. while fever, irritably unwell, red, brown, blotchy rash, often itchy on face, then spreads to body, and white center spots on the oral cavity or buccal cavity. Your diagnosis will be measles. So fever, cough, rhinorrhea plus conjunctivitis, again measles. Rubella. Remember that measles and rubella, they tend not to appear in the children who are fully immunized. For example, a 3-year-old child not immunized, high fever for 2 days, erythematous maculopapular rash on face, rash on buccal mucosa. Whenever there's involvement of buccal mucosa, the diagnosis will always be measles. And whenever there's involvement of soft palate, then your diagnosis will be German measles or rubella. A 7-year-old child presents with his mother to a GP complaining with a rash on cheeks, sparing the nasolabial folds and the eyes. The rash started 1 day ago and soon spread to the proximal limbs and trunk. He has mild fever. On one of his schoolmates suffered from the same rash a few days ago. So rash on cheeks in a 7-year-old child. What is the diagnosis?
Erythema infectiosum, parvovirus.
Yes, parvovirus B19 or slab cheek syndrome. Now, rashes and stool, scarlet fever. Keep away from school and nursery until 24 hours from starting antibiotic treatment. So, a person with scarlet fever can join the school 24 hours after starting the antibiotic. In impetigo, the the child will be kept away from school until the lesions are crusted or after 48 hours after starting antibiotic treatment. Similarly, for chickenpox, either the lesions are crusted or 5 days has passed from the onset of the rash. In case of measles, we need to keep the child from away from school for 4 days. In case of also, do not withdraw from school or nursery in hand, foot, and mouth disease, cold sores, molluscum contagiosum, roseola, and parvovirus B19. So this was all about viral rashes in pediatrics.